Good morning, everyone. Happy Big Orange Friday and welcome to today's live update. I'm Provost John Zomchick. Chancellor Plowman couldn't be with us today, and so she asked me to step in. I'm joined, as usual, by Student Health Center Director, Dr. Spencer Gregg. This morning, we're going to give an update on vaccine distribution, our COVID case counts, and other data. First, I want to talk about this morning's big announcement from the Chancellor. For those who may have missed it, Chancellor Plowman announced earlier this morning that we will have in-person commencement ceremonies on May 7th, 8th, and 9th. And for the first time ever, we will hold commencement in Neyland Stadium. You know, our students have been through a lot in the last year, but they've been resilient and they've persisted towards graduation. We are so thrilled to be able to offer them this unique experience. Because we're still in the middle of a pandemic, there will be precautions. But the pandemic is also the reason that we've been able to move the ceremonies to the stadium. Outdoor, socially distanced ceremonies are the safest options for keeping our graduates, their families, and everyone involved healthy. We will have a graduate hooding ceremony on Friday and 4 undergraduate ceremonies on Saturday and Sunday. After consulting with our health experts, we've determined that with a few modifications, we can safely hood our graduates and professional students. Our undergraduate ceremonies will be grouped by college. Seating will be limited because of our social distancing and our desire to make sure that the experience is a positive one for all those in attendance. We want everyone's guests to be able to see and hear what's happening on the field where the stages will be set up. Because of this, we'll be limiting the number of guests each graduate will be able to invite. Spring 2021 graduates and all 2020 graduates who haven't yet participated in a commencement ceremony will get emails today with additional information on how to register. Be sure to sign up if you plan to attend. After spring graduates have had an opportunity to register, if there is still capacity, we will allow spring 2020, summer 2020, and fall 2020 graduates to register if they have not already walked in a commencement ceremony. This is going to be a special weekend for everyone involved. I'm excited for this unique experience, and I actually had an opportunity to talk to some of our seniors last night to give them a preview, and they were thrilled too, as I'm sure many of our graduates will be. So much more for our commencement plans. Now let's switch back to COVID and check in with Dr. Gregg, who's joining us today from a vaccine clinic at our Student Union building. Good morning, Dr. Gregg. How's the vaccine distribution going?
Hey, good morning, Dr. Zomchick. It's good to be with you today. I am over at our vaccine clinic at the Student Union this morning, where we're providing some initial doses of the Moderna COVID-19 vaccine. We plan to provide up to 900 vaccinations today to those who've already registered for this clinic. And so far, we're right at about 400.
That's fantastic, 900 more vaccinations. Well, for those in our campus community who are eligible for the vaccine, can you tell us how they can sign up for an immunization on campus?
Yes, we'll be offering access to the vaccine through the remainder of the semester to phase-eligible and age-appropriate individuals through the Student Health Center during the week for university-affiliated faculty, staff, and students. And then we'll also be having a weekly vaccine clinic at the Student Union for the public, and these will also be inclusive of UT faculty, staff, and students. For more information about our vaccine clinics and how to sign up to receive the vaccine at one of them, we encourage folks to go to the university's COVID website at utk.edu/coronavirus and click on the vaccines tab. The information about registering is there. We can only provide the vaccine to those who are phase eligible and age appropriate. Currently, that includes phases 1A1, 1A2, and 1B, and those 65 and older. These phases and age groups will be changing through the coming weeks, so people need to be paying attention to that. You can go to the Tennessee Department of Health website at covid19.tn.gov and click on the vaccines tab to see what phase you fit into. We really encourage folks to get vaccinated as soon as they're eligible to receive it, and we would love to see more of our folks through our clinics here on campus.
Thank you, Dr. Gregg. That's great news. Remember, those of you who are phase eligible or age appropriate, go to our website and sign up for this opportunity. I did, and I'll be getting my shot soon. I just wanted to share that with everyone. So let's go to a data update. As of this morning, we have 78 positive COVID-19 cases. 70 are students and 8 are employees. You can see on the graph on the screen that our level of positive cases has remained relatively flat. We do not have, as Chancellor Plowman has pointed out in previous weeks, we have not experienced the spike that we did in the fall semester, and that's really good news. Yesterday, 3 new active cases were reported. And you can see on this graph, again, something that we're taking great heart in, and that is that our new cases have also remained flat. We now have 377 people in quarantine or self-isolation. This includes 222 students who live on campus, 117 students who live off campus, and 38 employees. There's been a slight incline in that graph you can see, but again, nothing like we experienced back in the fall. All very good news. Let me say a word now about clusters. We have identified 1 new cluster since last week's update, this time at the Phi Mu House. Like previous clusters identified in sorority houses, this cluster was designated as such because of the living arrangements inside the house. The cluster includes 1 positive COVID case and 26 close contacts. That is, it's a cluster because of the large number of close contacts, and the large number of close contacts is a result of the communal living arrangement in Phi Mu House. We want to thank the residents of the house for their cooperation with contact tracing and quarantining. Now it's time to move to updating everyone on our testing data. Last week, we collected 3,662 samples. We tested them, as we always do, in pools of about 3 to 5 samples each. Out of the 793 pools, we identified 22 pools and 124 individuals who were referred for diagnostic testing. Of those who were tested, we identified 25 positive individuals. All of them were residential students. The overall participation rate for residential students dropped again this week to 59.6%. I want to repeat what Chancellor Plowman has said again and again. That is too low. We want to see that participation rate up towards 70 and higher. And I want to remind all of our residential students that participation is required if you live in our residence hall. If you've lived on campus and have not been participating in testing, you will begin seeing repercussions, as Vice Chancellor Frank Cuevas outlined during last week's live update. Dr. Gregg, what's your reaction to the case counts and the testing data that I've just given?
Well, while we're very pleased that our on-campus positivity rate remains low at less than 1%, we're not too pleased, as you've said, with the participation rates that we're seeing. we really need to be seeing participation rates higher, more like in at least the 75 to 85% range. Even higher would be better. Our students really need to try to participate each week in the saliva testing. This is the only way that we know what's happening on campus, and these results drive our decisions regarding our on-campus mitigation strategies. So greater participation is needed in order for us to make the best possible decisions for the campus.
Thank you, Dr. Gregg. I want to talk to all of our vols, heart to heart. We really need you to do this. This is important for you. It's important for us. It's important for keeping the campus safe and healthy. So please participate in the pooled saliva testing. All right, now it's time to look at our metrics summary. As a reminder, this table includes indicators that we use to evaluate whether to tighten or ease temporary restrictions here on campus, such as residence hall visitation, dining in our facilities, and a host of other restrictions that we have put in place in order to keep everyone healthy and safe. Dr. Gregg, can you weigh in on how things are trending in our broader community?
Well, as our metrics indicate, we have seen an increase in active case counts this past week, but a decrease in new cases. This reflects a greater number of those having to quarantine because they've been identified as a close contact of a positive case. Now, in the greater Knoxville community, things are starting to look a little bit better. Their case counts and positivity rates are both declining, and this is good news, but it could be misleading. There's new strains of the virus that have the potential for greater transmission and potentially even greater severity of illness. So we really need to continue in our efforts at preventing exposure, where we could see these numbers start to rise once again, both on campus and in the Knoxville community. We certainly hope that's not the case, but at this point, we just can't say for sure.
So, Dr. Gregg, given that trends may change in the coming weeks, what advice do you have for our audience in terms of keeping everyone healthy and fighting this pandemic?
Well, as these new strains could significantly impact us in a negative way, and we'll hope to have a better feel for that here over the next few weeks. But it's going to be very important for everyone to remain vigilant, keep up their guard, continue to wear their masks, maintain social distancing, avoid social group gatherings where these measures aren't being strictly followed, and practice good hand hygiene. We know all of these things have a significant impact on transmission and exposure to the virus. So we really need everyone to stay adherent to those health and safety guidelines. There is light at the end of the tunnel, but we need to continue being patient in our approach. Even though spring is approaching and the vaccine is becoming more widely available, we still have to be very cautious.
Thank you. Well, Vols, you've heard the good doctor. Now's not the time to let down our guard. We've come so far, and you've all done so much in helping us keep the campus healthy and open. Let's continue to practice all of the good things that Dr. Gregg has told us to do. There is light at the end of the tunnel, and we will come through this, and the campus will return to more normal operation in the summer and autumn. So let's just keep doing what we know is the right thing to do. Well, thanks for joining us this morning. That's all we have for today. I hope you have a safe and healthy weekend. Stay dry if you can. And as always, go Vols.